Malta. Robert, pero ¿qué noticia?
Doctor Valenzuela, ¿cómo está?
Muy bien, ¿y usted?
Esa es Patricia Thompson.
Sol anda por aquí.
¿Cómo?
Soy la Tejeda que anda por aquí.
Robert, pero ¿qué
No me diga, ¿cómo está Soylita?
Sí,
¿Está Soylita una maravilla?
Hay como un eco.
Sol anda por aquí.
¿Cómo?
Soy la Tejeda que anda por aquí.
Ya sé ella ahí. Vamos a ponerla a ella a hablar también. ¿Está Soylita una maravilla?
Hay como un eco.
Sol anda por aquí.
Got a big echo, buddy.
Soy la Tejeda que anda por aquí.
Ya sé ella ahí. Vamos a ponerla a ella a hablar también. ¿Está Soylita una maravilla?
Mira, Carlos, tú oyes como estamos como un delay muy grande.
Big echo, buddy. Yes, it's a big delay. It's okay. In case I curse, you can shut it off. But you got to get it off the main, otherwise it's going to have feedback during the speech. Yes, it's a big delay.
Ahí
It's
está,
okay. In case I curse, you can shut
ahí
it
está,
off.
ahí está Edwin. Edwin, ¿cómo estás?
But you got to get it off the main, otherwise it's going to have feedback during the speech. Yes, it's a big delay.
Ahí está,
It's okay. In case I curse, you can shut it off.
ahí está Edwin. Edwin, ¿cómo estás? ¿Por qué tú crees que está ese eco? ¿Será porque todos estamos con el micrófono abierto al mismo tiempo?
Bueno, el que no esté hablando, que pongan el micrófono en mute.
¿Cómo están?
Susie.
Sí,
Yeah, Susie
hay que
has
poner
to
el
put it
micrófono
on
en
mute.
mute si no se habla.
Pero tú
Y
sabes por
Patricia
qué está
también.
ese eco también, porque tú tienes el YouTube abierto, ciérralo. Cierra la página de YouTube.
O baja el volumen.
¿Cómo están?
Susie.
Sí,
Yeah,
hay
Susie
que
has
poner
to
el
put it
micrófono
on
en
mute.
mute si no se habla.
Pero tú sabes por qué está
también.
ese eco también, porque tú tienes el YouTube abierto, ciérralo. Cierra la página de YouTube.
¿Quién, yo?
O baja el volumen.
Sí.
¿Cómo están? Sí,
Yeah,
hay
Susie
que
has to
poner el
put it
micrófono
on
en
mute.
mute si no se habla.
Pero tú sabes por qué está ese eco también, porque tú tienes el YouTube abierto.
No, yo no tengo YouTube abierto. ¿Quién,
O
yo?
baja el volumen.
Sí.
No, loco, yo no tengo YouTube abierto.
Que sí, yo lo abrí cuando se conectó ahora y minimicé la página, pero me salí de la computadora. Tiene que abrir el browser y cerrar el tab de YouTube.
Ya se cerró.
Ya,
Ok.
Carlos, ya se cerró.
ok.
Okay, are we on? I believe are we on?
Yes, we are.
Okay, so. Okay, so Susie, take it over. Susie, you are mute. You have to unmute yourself.
Hi, good morning. Can you hear me?
Yes.
Yes, we can.
Wonderful. Good morning. My name is Suzanne Magalhaes. I am the director here of continuing education at Ncma. It's been a great learning experience to share with such an amazing team and also have the same vision to reduce pre-analytical errors and also help the majority of our members reach a different national standard level. And right now, I would like to take a few minutes to introduce and welcome Dr. Robert Valenzuela.
Good morning, everyone. My name is Robert Valenzuela. I am the medical director. Just a little bit of a background. I'm currently the director of penile prosthesis surgery at Mount Sinai School of Medicine. Now, in my background, I too was a medical assistant. I was a phlebotomist. I was an EKG technician. And little by little, I did that all while doing my undergraduate prior to going to medical school. Now, we know it has been a very difficult year. Before we begin, we would like to acknowledge and thank everyone for the work and dedication and sacrifices that our frontline healthcare workers have made. Our medical assistants, phlebotomists, X-ray techs, EKG technicians have been essential healthcare workers in providing medical care to those affected by the pandemic. Now more than ever, there is a demand for certified, and I emphasize the word certified, ancillary healthcare workers to provide quality healthcare for our patients. The healthcare professionals have an obligation to exhibit actions that reflect values and ethical principles. It is important to obtain the best possible training and certification to demonstrate proficiency in your field of expertise. You know, the National Certification Medical Association Code of Ethics has set forth values and principles to guide professional conduct. In healthcare, one of the principal code of ethics is, Dante knows well, is do no harm. This means that we can consciously avoid harmful actions and adhere to all applicable laws and regulations in the choices that we make. Now, as a certified member of the Ncma, this places service the health and welfare of persons before interest. They respect and understand that a healthcare professional is dedicated to providing competent healthcare with compassion and respect for human dignity and rights. The member upholds the standards of professionalism and honesty in all professional interactions. They should be knowledgeable about established policies and procedures for handling concerns about unethical behavior. You know, as well, we come in contact with a whole host of people. As a healthcare professional, we are entrusted with the patient's personal information. We are expected to respect and safeguard the rights of and privacy of patients, clients, colleagues, and other healthcare providers in accordance with the law. This includes, but is not necessarily limited to, being familiar and carrying out all HIPAA compliance requirements. Now, healthcare providers value his or her responsibility to participate in activities contributing to the improvement of the community and betterment of public health. And we have seen this throughout the year. We see all kinds of volunteers, of medical assistants giving out vaccines and assisting in vaccination. A certified member is expected to truthfully and accurately state one's own credential, professional education, and expertise. And lastly, as a certified member of the Ncma, any healthcare provider is expected to uphold the standards of professionalism and commit to performing their duties competently and safely and ethically. I'd like to thank you for inviting me. Thank you for having this moment with you. And now I would like to welcome our advisory board. We have Mireva Barrera, she's a member, Dr. Juan Flores, Dr. Edwin Kardash, Dr. Patricia Thompson, and Dr. Claudia Cruz, who will be working with us today, and Professor Dante, who will be giving a talk on behalf of the Ncma. Thank you.
You're welcome. You're welcome. Now, Susan.
Hi, once again. Now we'd like to introduce Carlos Aguavives. He is our computer tech. He will be able to give you more details and a better explanation of our webinar and how to work through the system. So let's take a couple of minutes to welcome Mr. Carlos.
But at the same time, I'm sorry if I may, let's hear a voice, a few words for each of the advisory board member. I know that Dr. Edwin is on the hub zone right now working I think it's in Connecticut, in oncology, I believe it is. Let's start with him so that, because I know he's active working, you know how is this?
Yes. Good morning to everybody. So I'm Edwin Kardash. I'm a medical undergraduate in Dominican Republic. I also am a registered nurse in the United States, also an Ncma medical assistant. EKG technician and phlebotomist. It is a pleasure to be part of your committee. I just got out of the area where I'm taking care of the patients. And yes, we actually take good care of our patients in here. We use our PPE, and we use in our hospital of Central Connecticut a system to identify patients by two members of the team to prevent errors. Usually when we take samples, we have two nurses or a nurse and a tech verify every sample that we take. That way we decrease the errors that we do. Identifying errors of the patients, this French face is corrected by this method.
All right, please, the other members.
Hi, my name is Claudia Cruz. I'm a doctor. I have a master in public health system and also epidemiology. Here in the United States, I'm a registered nurse. COVID-19 cases and hospitalizations are rising around the world as the Delta variant spread fast and other variants as well. We are in pandemic with new COVID cases every day. COVID is preventable. As a preventable disease, we can avoid following standard precautions, such as wearing face mask properly, cover nose and mouth, or get the vaccine. Here in the United States, we have different choices of the vaccine, single dose or vaccine with 2 doses. Social distance, I know in the medical field is quite difficult, but we must try and continue with hygiene precautions. Every time that we are in contact with patients or people around us, soap and water or hand. If we follow those simple steps, we can control COVID. Thank you.
Mireya.
Good morning. My name is Mireya Barrera. I am a medical doctor from the University Autónoma de Guadalajara from Mexico. I am a registered nurse here in the United States. We've been battling for about 1.5 years now. Main point I want to address is do not put your guard down. I've seen a lot of coworkers get reinfected because we were out of the clear and we're not. It is getting worse. Definitely wear proper PPE, like my coworker said. Always keep your guard up. Always keep your hygiene. And also get vaccinated. Vaccines are definitely working. I work with a lot of liver transplant patients. We lost a lot of our patients last year, obviously because they weren't vaccinated. We're seeing patients get sick from COVID this year, but they are in their home recovering. So vaccines are definitely working. We are urging our patients to get the 3rd dose because of the immunocompromised medications they
I think Dr. Mireya lost her signal.
I'm here.
Okay, because we don't see you.
I'm here. Okay.
But
Do you see me now?
no. Don't worry. In the meantime, yeah, no. We just see you, but I mean, we just hear your voice, and even your voice says that your microphone is mute. I apologize to all the listeners. Is that this is live, and this is the first time we're doing this without actually rehearsing. All right, so I'm sorry for these type of, let's say, of technical problems. All right. So in the meantime, let's continue with Flores. In the meantime, Dr. Mireya comes back and she's driving too. All right. So let's start with you, Dr. Jose Flores.
Thank you, Dante. Hi, my name is Jose Flores. I'm a doctor back in Guatemala. I graduated from Universidad de San Carlos de Guatemala and got a postgraduate fellow in internal medicine and a subspecialty in nephrology and kidney transplant. Here in the United States, I started being and studying like CMA, phlebotomy, and EKG technician. Recently graduated from RN programs and going for my nurse practitioner. And as my previous colleagues expressed, COVID is a constant issue in this country and I think around the world. So we have a lot of limitations when we travel or when we stay in our fields. I usually work with a lot of patients because I work currently on an outpatient clinic in a private clinic with a surgeon, and we are seeing a lot of raising in cases. We are diagnosing between 2 to 5 cases every single day. Some of them, the most are asymptomatic, but the most of them who are symptomatic has to be sent to the hospitals and be admitted because usually they have a lot of comorbidities. So as my previous colleague says, standard precautions, contact precaution, airborne precautions, and eye protection are the main state for prevention and to avoid the spreading of the disease. So I think part of the education at this time will be the PPE use in people who is healthcare worker, and I hope you will do the best when you graduate from the courses. Thank you.
Right, Dr. Patricia Thompson. You are mute.
Keeping myself away from the echo.
Okay.
So, like Dante say, I'm Dr. Patricia Thompson, graduated from medical school in Dominican Republic. So Dante and I share a common background. I graduated from the UNFU, Universidad Nacional Pedro Enrique Sureña, and I came to United States, and my husband didn't want me to go back. So I actually did a specialty in healthcare management and business administration. But I worked more than 20 years educating medical professionals, especially Berkeley College in pharmacology, medical terminology, phlebotomy, EKG, microbiology, you name it, even coding and billing, which is also one of my passions. I created a reimbursement company. And right now I'm working in healthcare management and volunteering with Dante and all his adventures, educating students, which is always a pleasure. So this year was a tremendous hit for our community, for the whole world, entire world. And basically the work that we've been doing in research, we've been sharing with a lot of the students, and it's all volunteer work, and it's always a pleasure to be part of this. Thank you.
Okay. So I think Dr. Mireya is having a little difficulty trying to reach on, and let's try to do this. And Dr. Patricia Thompson is going to be the one most likely that when any of the viewers ask any question, and perhaps we would like to know who are there, if they could say hi or they could say something, and also Susie and Patricia could look what they are writing down so that you could state their questions, all right? So that we could answer the question to the best of our knowledge. Independent of that, we are going to continue now. We're going to officially start now with Carlos Aguavivas. Carlos is going to actually bring to all of the participants that are doing their continuing education renewal tomorrow, Sunday, because the agency heard all of the suggestions of the past previous members doing the renewal. As you know, the renewal was Friday, Saturday, and Sunday, 3 days, So many of them were like, why we cannot do this in only one day? And also many of the members that were going through as they were doing their webinar, they encounter some difficulties that they have to be typing, sending emails to the agency, and then the agency, Mr. Carlos, will actually reply back and guide them to do how to correct it. And that's one of the things that we are planning to do to make things easier and better. So Carlos is going to explain to those that are going to be tomorrow doing their continuing education. And if anybody else that is not a member of the NCMA would love to be part of us, by all means, just send an email, contact Susie. Susie is the director of the continuing medical education department. She's always the one that actually receives the applications and the documents, and she correlate with them what you're missing, what you're not missing, and she works with them. So she is the person that you want to talk. Regardless, just send an email through, I think it's info@ncmanow.org, and from there you will be able to get either the director or the director Ruth Patterson, or Mr. Dr. Robert Valenzuela, in the event that is any other doctor that wants to inquire about anything else. And Susie will be the one kind of like logistically wise, administration wise, in getting the information and validating whoever that want to be a members of ACLS. Now we have back Mireya. So let me just give like a few minutes so that she could finish what she was saying. And then after that, then everybody will mute their microphone. I'm going to start sharing the screen so that we could start seeing what we're going to be talking about today, which is going to be about the statistics on how we have globally people infected and vaccinated. And we're going to talk about how good and how bad vaccines are, because we have many other questions like that. In the CMA program, continuing education program, from tomorrow, we have a lot in phlebotomy, a lot in EKG, cardiac telemetry, in medical procedures, in infections, and vaccination. That will be tomorrow. Today, I'm just going to have a glance of basically everything. We're going to be talking about pediatric and vaccine. I'm going to talk about a little bit about genetics in terms of how is it that these vaccines do not replicate in you. I'm going to talk about that, and you'll see, so that we could clear some stuff out, okay? Because even though I'm part of the front COVID line, the FLCCC with Dr. Paul Merrick, and I'm pro-vaccine, and Dr. Paul Merrick is the #1 guy that you have to follow. Look for him, Paul Merrick. He is the one that stopped the death from septic shock in ICU, just using high doses of vitamin C. He is a pharmacologist. He has like 5 boards here in the United States. So frontline COVID, I forgot the name, is FLCCC. I know they're gonna kill me, but anyway, I survived. I survived a marriage, so I think I'm gonna do okay. Anyway, so Mireya, please, can you finish in 2 minutes so that Carlos start, please?
I am so sorry to interrupt the both of you. Our chat is disabled for live stream. If Carlos can address that, no one is able to reach out or comment right now at the moment. The chat is disabled for live stream. I've received 5 different emails in regards to that matter.
Okay.
I'm taking attendance another way.
Okay.
All right. So Carlos, can you?
Yes, I'm already checking that out now.
Thank you so much. I appreciate it. Sorry about that, Mireya.
It's okay. Sorry about.
Yeah, but in the meantime, Mireya could actually, put a few words.
Yeah, I'm really sorry about I lost connection. But yeah, my main point was the urgency of getting vaccinated. I know a lot of people in the medical field are on the fence about it, but looking at the data with our own patients that are surviving because they were vaccinated, I really believe we shouldn't be in this field if we are not leading by example. And leading by example would mean getting vaccinated.
Yes. Okay. Now we're waiting for Carlos. I believe that he's trying to somehow correct the stuff. It is bad because this is the first time that I'm doing this. Normally, the director, Ruth Patterson, she's the one handling everything, and she has some issues. It was her birthday yesterday, but then today she got some issue with the family and COVID and stuff like that, and I hope the best for her. And now, so we are like kind of like improving what we don't really know, about all these little things. Nevertheless, I would like to tell everybody, okay, that in reality, me, myself, and I'm going to speak for everybody here, none of us, but everybody, if you love to say something, none of us have any conflicts of interest with any of the things that we are going to talk about or promote or say. I don't work for no pharmaceutical industry. I don't work for any hospital that has anything in contrast of interest directly or indirectly. Everything that we are doing here is for educational purposes. And once again, nothing that we are saying now here, okay, is with any benefit other than educational information. Okay, so in the meantime, that we are doing this, yes, Susie, you would like to say something?
I'm currently I'm receiving a lot of feedback because nobody could comment, so I'm just trying to address them as you speak. Can you hear me?
I could hear you, yes.
So that's really what I'm doing right now, just working on answering everyone's concerned that their attendance is not taken, and I have Ms. Patterson also reaching out. So I was just replying to everyone. Sorry about that. I find it very interesting. I love to work with such an amazing group. You guys all have something to share, and it's just amazing how rapidly we've gathered information to try to take control over this COVID. And I love the fact that everyone in this group, that we work so hard to find and discover all this. So for me, it's great pleasure to learn, to be here, to be a part of this. And I'm here to help all the members that are listening now. I take great pleasure and joy in what I do. I do it from my heart. It's really important for me to know that you're not only able to challenge the theoretical exam, but also do a hands-on experience and pass the practical end to make sure that we're offering our patients the best quality care. So all around, my heart is wrapped around this agency. I love what we stand for. I love the people that we work with. And I'm really excited to be a part of this and to be able to share my experience and also grow and learn so much with all of you. Not only my coworkers and the advisory board and our board members and all the doctors that I interfere with or interact with, both here and on an international level, but it's amazing that we've been able to put this all together and offer this amazing I don't know what to say, program to the world, you know, and stand out so differently. So thank you once again.
Okay, very good. Please, okay. Yes. I know that all of you are working and we're getting annotations here, okay, from our members. Yes, you could go. We're going to stay here because I know you guys are working. And also Edwin, thank you, Edwin. Patricia and I and Susie, we're going to remain to conduct and finish this. Also, those that are participating as a listener, can you share, you know, so that people know that we're here and so that we could deliver this information to others too? Please do so. That will help a lot. Okay, bye, Flores.
Bye-bye. Feliz día. Gracias.
Okay,
Thank you
bye,
so much.
Claudia.
Bye-bye.
Okay, see
Feliz.
you soon. Okay, Carlos is the one that we're missing. Carlos now. And Mireya also, if you want to stay, you could stay, okay? But I know that you're busy. I know you're going out there to work. And so anyway, take care. Thank you once again.
Bye. Thank you so much.
You're welcome.
Bye.
Yeah, give me 1 minute. I'm still trying to get this going.
Okay, so in the meantime, so you know what? In the meantime, those participants that are with you, Susie, if you could just tell them, you know, if they want to please share what we are doing, okay? Because actually, I want something for them to express it or to other people's too. So in the meantime, that we're getting ready for Carlos, I'm just gonna put the pictures of all of us there so that everybody could see us, you know, even though that they are not there no more, okay? And you know me, taking my tea. Okay, so in the meantime that Carlos is doing that, let me just talk a little bit about history. History in regards to, and this is good for all of the listeners, all right? So sometimes we start thinking, how many people have died globally? And we look into that through the whole pandemic history of our existence. Let's say that in 1918, where we recorded the first Spanish flu pandemic, around 75 million people died. The average of those people that died was like 27 years old. Then we had another one in 1957, H1N1, and about 3.1 million people died. The median average age of those who died were 65 years of age. Then in the year that I was born, 1968, we have the avian flu, the H1N2, and that year about 2.3 million people have died of this virus. About the age were also about 62 years of age. In 2009, we have again the influenza H1N1, and there we have about 400,000 people death, okay? About the same, 50 to 62 years of age. And now since 2019 till now, we have around more than 7 million global death. So I'm bringing this on just for everybody to have an idea that the reason why we have a decline in many of the death, first of all, is that we know a little more now. There is more technology. We have vaccine, the food, the hygiene, the toxic that we found in the environment, in the food, in the nutrients, okay? They all contribute a lot to our immune system. So one of the basic structure that God, those who believe in God, I'm a truly believer, even though I'm a scientist, I'm a doctor, I know this body, nothing that we have could ever been evolutionated by nothing. There is no way, from my point of view, on how perfect is our body. It is so perfect that we have an immune system that after we get exposed to a pathogen is something that causes disease, that after we expose to a pathogen, our body not only copy it, break it down, make a memory, and if that pathogen comes back again, the body produces antibody that will kill right away. And I'm going to talk about that a little bit in genetics too. All right. So our body is amazing, but we have to support our cell functioning levels because we don't see that. We don't see that. And because we don't see how is internally our cell biology structure, normally those that are not in science do not understand all the things that we have. You know, I know that I'm going to bring some information about specifically our genetic material that is going to perhaps shock many people, but it is science and it's the truth and it's what we found there. And that just to say, I know that there were always concerned lately about the injections. And when we talk about the injections of vaccine, for example, in children's, okay, I want to say that we have a problem still now. We do have a problem. The problem that we have is that we're still having at least 40 children die every week, at least in the United States, of this COVID, you know, and that's not good. Around 25,000 children get infected every month. That's in the United States only. And I have some surveys, statistics that I'm going to show you from where I get all my information so that you could be able to actually look information from a credible site. That's one of the reasons why we're doing this, because there is so much misinformation. There is so much sensationalistic information out there that sometimes you don't even know what to believe. And I totally understand everybody's concern about if I should get the vaccine or if I should not. So just let me say that right now, there is a specific site in the Center for Disease Control that is in regard to the pediatrics information about vaccines. And right now we know that it is being already approved from 5 to 11 years of age vaccines, okay? And it has shown that it's safe. It does not cause any problem so far, what we have seen. We're still too early to tell because normally our immune system always have the memory B cells that produces the antibodies to defend us against anything that we've been exposed to. And they last easy 8 years, 9, 11, 17 years, 20, 25 years. So we're still too early to tell what we may see in the future. But what we could definitely see is that those that are vaccinated has less percentage of dying or getting a serious, severe disease based on COVID. Now that we know that this SARS-CoV-2 or this COVID-19 is a systematic disease, it's not what we used to believe, that it was an acute respiratory distress, that it was just in the lungs. Oh no, this is a multi-system approach disease that this virus have done. And I'm going to talk a little bit about that. That is the reason why I will say to all of you, you need to vaccinate yourself. I implore you to vaccinate. I'm going to talk about, and I would like to hear questions like why you don't think you should get vaccinated, so that we could talk and have a nice talk without aggravating anybody's belief. And I believe that all of us could say and express what you want, but it's good if you are good informed, scientifically wise. Okay. I don't know if Patricia Thompson has something to say about that. Okay.
Thank you, Dante. Can you see me? Because I don't think my camera, even though my camera is on. I don't know.
Yes, I could see you.
Okay, perfect. Yeah, so I always admire how you present the facts, and you are very, very thorough in your investigation and your research before you present the information to the students or the audience that you have in front of you. I basically encourage everyone, like Dante says, to even go ahead and expand your own scope of research and look at the website that he's providing. look at the statistics that he's providing, the resources that are amazing. I mean, I've never seen anyone being so inquisitive about the data that's out there. And, you know, Dante and I have been sharing, you know, this type of experiences, challenging each other, challenging, you know, the truth of everything that's out there. And it's always a pleasure working with him because he's very open in listening to other people's views. He respects other people's views, but he also provides feedback that everyone can make their own decision based on what's displayed on the table, which is, you know, very admirable.
Thank you. As I was saying, you have what is called COVID-NET GIS. I'm going to write it down. COVID-NET GIS .cdc in the government. O si tú entras al CDC, en el Centro for Disease Control, tú puedes buscar el COVID-NET. You could look for COVID-NET. Se me fue el español. The Spanish got messed there. You know, I'm Latino, I'm Latino, so I'll be Spanglish, you know. And if I have to throw some Chinese word, I will throw it out too. Because everybody knows I'm Chinese descendant and Dominican, and I was born in Queens.
Oh boy, what a mix.
a whole mix, okay? So you could easily get into the AAP, A as an apple, P as in Peter, AAP. You could go into the special CDC pediatric data. A special CDC pediatric data. They have all the information too. And COVID-NET, that CDC. Okay, they could give you all the things. And right now, the mostly one that everybody's using and all the data that we're getting is from Pfizer and BioNTech. Okay, they already have finished the phase 2 and phase 3, and is with the second dose. The only difference with the pediatric dose at the adult dose is that in pediatrics that we only are getting to the patients 10 microgram. Normally for us is 30 micrograms. So because of the volume of the person and the size. So once they complete the 2 doses, then they will have, now we have seen is up to 87% in preventing the disease, not the infection. Remember everybody, the vaccine was not made basically to prevent infection. The vaccine was made to prevent ill disease, severe disease, that you don't die for everybody was dying at the beginning. In another word, infections means that you could get infected and you don't know. And you don't know that you have it. And that's another something different from the SARS-1 and even from flu. Sometimes you need to have symptomatology, symptoms for you to spread and to be contagious. With SARS-CoV-2, you could have the infection, not know it, and infect others. That is the bad things about this SARS-CoV-2. And the reason why I will always advise for you to get into vaccination. Now,
So Dante, I'm sorry to interrupt you. No, it's good that you started with that because people think that, oh, well, I got the vaccine, so I'm not going to get infected. I'm not going to get the virus. And that's not necessarily true. What you're not going to get is a full-blown disease and end up maybe intubated. Because some people think, well, I was told that if I get the vaccine, I'm not getting the virus, right? Okay. That's a misconception.
Yes, it is. It is. Okay, Mr. Carlos is already ready, so let's go for it.
Okay.
And do you have the screen, right, to share?
Let me see. Hold on a second. Suppose you have to enable it on my end.
Okay, hold on. Okay.
Okay, hold on.
Yo me da un duro. I'm ready. I'm learning a lot. I think I did it.
Okay, let's see. Okay. Let's share.
And Susie, see if everybody could now make this stuff.
Okay. All right, can you see my screen?
Yes, we can. Well, I can.
Okay. All right, so everyone should get in their email this document with, it's like a quick guide that tells you the link, how to get into the system. So first, you will go to the link that's provided here, ce.ncmanow.org. And then you're going to enter the username and password that were provided by the email. Now, when you log in the first time, you're gonna get this screen here. Let's lower this. You're gonna get this screen that's gonna ask you to change your password, because the ones that you get assigned is temporary. And here is usually where a lot of people start having issues logging into the system, is because they change their password and apparently they forget which password they chose. So make sure that when you're changing the password, you write it down somewhere. Okay. After you make the changes, you should be able to get to the screen and click on continue. Once you click on continue, you should be able to see your courses right here, the webinar. So you're gonna click on the webinar. There's two parts right now. And you're gonna go through the whole process. So I'm gonna show you on the screen. Okay. So now, when you get to this screen, this is the first part of the webinar. So you see here, you have the introduction, you have the different sections where you have the SARS-CoV-2 history, virology and immunity, genetics, and so on. You got to start with introduction. Once you are done with introduction, you go to the next session. You won't be able to jump to other sessions. I mean, you gotta go in order before the other sessions are enabled. Now, each section has a quiz after. So when you're doing your quiz, you gotta make sure that you answer all the questions correctly, which is going here. So this is what it looks like. And you are able, let's say, I'm just gonna put different, just for the sake of it. And then when I submit it, it gives you like a review here if you want to submit it or go back. If you're sure, then you submit all and finish. Now here it will tell you that you got number 1, you got it correct, number 2 and number 3 wrong, and number 4 is correct. So you got to restart the quiz and do it again. So you got to make sure that in the gray here that you answer all the questions correctly 100% before proceeding. Otherwise, if you don't get this, you won't get your certificate. Okay. And that's, basically it on my end, Dante.
Okay, so what you're trying to say for everybody is that as they go, once they do a lecture, they have to go into the survey And after they put the survey, they have to submit the survey, and then they have to do their test. And once they do the test, that they could do it right there, it will give them the answer, what they got right and what they got wrong. And if they have some questions wrong, they have to do it again, unless if they don't get it right, they won't be able to get their credentials.
Yes, that's correct.
Also, that the most common problem that you have seen is that once they get their temporary password, once they change the password, if they change the password, they don't remember, they're going to be locked out and they won't be able to get inside.
Yes, so I mean, they can, there's a link there to reset the password, and they can reset it themselves. Now, that if they are having any issues, they could also, anything that's technical related, they can send an email to support@ncmanow.org.
Y eso está, and that is next there.
That
Is in a place that they could see it.
no, I mean, that has to be in the email when it gets sent to them.
Okay, so they do have a link. They do have a link that they could have to go there in order for them to, whatever technical inconvenience that they experience, so that they could send the issue that they are having.
Correct. And anything else related to the webinar, if they have questions, or once they're done with the webinar, they have to direct those questions to info@ncmanow.org.
Okay.
Only use support just for technical problems.
Okay, Susie, please, can you ask or Dr. Thompson, can you ask or can you read whatever question these participants are asking?
Sure. I see it in the chat, right? There's a question. If you received the vaccine, I'm sorry, as he says, I've seen immunized patients that have mild illness and no symptoms at all.
Okay, no, that's Dr. Edwin, that he made a comment like on those patients that had vaccine, that they are going into the hospital, that they get ill, but they don't get severe disease. Making a point that the vaccine does help you in not getting into a severe state. But I'm talking about those participants that are going to be doing tomorrow their webinar from their houses. Okay, I want to see if they have any questions or any question or any comment. So I don't know if Susie be able to see it. I don't know if you could see it, or I don't know if Carlos got to be able to allow them to write and to make annotations.
Yeah, maybe Susie can see, in her email, because the chat is not showing any questions from his students.
Okay. Okay, so Carlos, you let me know when could I take over so I could change the slide.
Yes, yeah, you could take, I'm done on my part. And as far as the being able to chat, send messages, I mean, everything is enabled. I don't know why it's not working now.
And Susie, can you or can any of the participants write down something now so that we know that whatever question you have, you are able to actually write it down and put it to us? And Carlos, I think you have to disable yourself so that I could have the meaning of the.
Okay, hold on a second. Let's see.
I'm sorry, everyone. These technical difficulties is the first time that I'm doing this.
Okay, try it now.
Okay, let me see. Okay, so Are you receiving something?
I can see your screen, Dante. It's showing the Johns Hopkins University picture.
Yes, because I want to actually being able to show everybody, you know, where they could actually go for, but somehow, Carlos, I cannot see the whole screen so that I could select my view in what I'm doing. Anyway, in the meantime, what I'm showing now is the Johns Hopkins University, which is one of the sites with more credible and respect from a science point of view that could bring all the time the most up-to-date and close to reality that we could possibly have. So if we go back to them, okay, what they are showing right now, as of today, that we have global debt, okay, about 4 million, almost about 5 million people dead all over the world, okay? We have around 234, almost like 300 million people being infected of these SARS-CoV-2. And in vaccination, we have around 7 million people vaccinated globally. Like yesterday in the United States, it was about 846,871 vaccines given in one single day, with a total of 184, almost 185 million people being vaccinated in the United States only. About 56% of the United States population is already vaccinated. That's one thing that I would like to say. Independently of that, that we are talking about you guys, everyone that is in the healthcare area, I want to bring to you the statistics on infections only in healthcare workers. That means you and me and everybody that really works in the medical field. It could be in a laboratory. It could be in a lab. It could be in an office. It could be in a hospital. It could be in emergency. It could be anywhere. Okay, we have that in the United States only. Okay, this is coming from nurses.gmn. Okay, and also from the Center for Disease Control. We have around 152,888 infections among healthcare workers. Okay, the majority of the people infected somehow are women. Okay, we have like around 71.6%, and the majority of them are nurses, 38.6. So why the majority of nurses? Well, they're the one that provide patient care. Even though the phlebotomists take blood, EKG, do the electrocardiogram or cardiac monitor, the medical assistant provide injections and take vital signs. The one that have direct contact are the nurses, and we have to like really applaud the nurses, the RN, because, and everybody else, of course, but the RN are the one front to front and in the bed with all these patients, okay, with everybody, okay, and we have to support them. But it happens to be that the majority of death occurred in men, and they are mainly doctors. So from these statistics, what we have seen is that men and doctors are the one that basically has the higher rate of dying from this COVID-19 vaccine. So once again, this information, this data comes from the British Medical Journal. Okay, there is a specific statistic that they always bring. Okay, and it's known as BMJ Global Health 2020. Of course, that this is an approximation. We have to really go again today and tomorrow, because every day things change. But this just gives you a specific idea of the rate and the frequency of infections in the United States among healthcare workers. So about more than 400,000 healthcare workers that we have, 152, almost 153,000 get infected. All right. So that is one thing that we have to have in common, knowing, in common, sharing the knowledge. Okay. Any question, Doctora Patricia?
Yeah, actually, I understand that a lot of our students are from Latin America. So there's any statistics that we're going to show, you know, happening in South America, Central America, and the Caribbean?
No, at this point, no, because this was made specifically to give an idea for those members that are going to do their webinar tomorrow. Okay. So that for what they could expect in what they're going to go through. You know, definitely when we do our podcast next Saturday, perhaps we could bring those statistics and we could really do that. We could really do that, yes.
And then one quick question, Dante, knowing that the majority, you know, we understand that, as you mentioned, 71.6% were mainly women, and within the 71.6%, almost 40%, 38.6 were nurses. That correlates with the actual population of nurses in our healthcare system, right? So yes. The majority of, you know, healthcare workers are women, and then and also, you know, then most of the nurses are women as well.
Yes, yes, indeed.
What I find very curious is that the very interesting is within that it's mainly men, and from men is doctors. So that's actually interesting to see.
Yes. Somehow, yeah. I don't know the details, but I cannot really say much about that. Okay, because I don't know really the detail. We're just looking for the incidents. Okay, the incidents in how everybody is getting infected or dying from the healthcare point of view, because I want everybody that is in the healthcare field protect themselves. Don't believe that because you already have or have been vaccinated, that's it for you. Vaccination does protect, but you still need to keep yourself with your face mask, with social distancing. You need to, I know it's difficult, but you need to do exercise. You need to eat well balanced. Sugars, we already know that are not good. When you are obese, when you are diabetic, when you have high risk, like cardiovascular diseases, when you have all of that stuff, it's not good because it increases the risk of you developing more of what we are seeing, of this bad side that the SARS-CoV-2 actually produce. Now, these that I'm putting down here, I want everybody to understand that it is not like everybody believe this is part of genetics. It is not what everybody believed, that they just came yesterday in the how did we did a vaccine so fast and how we do this so fast. This was already, this is something wrong. No, we know a lot of stuff. And for you to know, this is called a phylogenetic analysis, specifically of the spike proteins, okay? So this is the whole family, well, kind of, let's say, coronavirus comes from, okay? So that everybody knows all the viruses, most of the viruses comes from three sources only. Three sources: bats, rodents, and birds. Okay, so we have a lot of viruses there, all right, and surrounding the environment. When you go to the beach, when you go to a swimming pool, when you go to have fun in the river, you know that you're bathing yourself a lot in many viruses. viruses that are really, if we take all the viruses found in the sea, is like 10 to the 30th time more of what we could practically see. We don't see that because they microscopically, but viruses are being with us all the time. So this that you see here, it is very good to understand that this is practically the main structure of what we could see with this coronavirus, with the SARS-CoV-2. We have the little blue kind of square there. Okay, that's the spike protein. So this COVID-19 has approximately 26 different types. I don't want to say different types. It has 26 spike protein in the outer surface. In this outer surface that you see here, in this membrane here that we see here, there is 26 spike protein. So what the science is doing is getting this spike protein, the actual messenger RNA that we have here, that is the one responsible for making all of the proteins, but the only thing that we are isolating is only this spike protein. So, but nevertheless, besides the spike protein in this outer molecular structure of the SARS-CoV-2, it has a membrane protein that actually covers it. It has an envelope, okay? It has the nucleocapsid, and it has a viral messenger RNA. Now, all of this, in order for this to actually stay, let's say, replicable, that it could actually multiply itself, it needs to be in a live human being, in a live cell. Because let's say that you guys cough. Right now, let's say that I have the virus and I cough in Dominican Republic. If it gets into the air, he will not go to Puerto Rico. He will not go to the United States. He will not go to Argentina. He will not go to Dominican Republic. He will not go to any place. Why? It won't last, because it needs to have a live source, a live tissue. So if you get into an airplane and you don't have your face mask, as well as your children and everybody else, if you have the virus, you are going to be shedding to other people. And that is how things spread. It's not airborne. It stays in the air for X amount of time, but we breathe it in and we spread it out. That's one thing that I want you to know. I also want you to know that our body, God gave us an immune system in which the B cells, the bone marrow B cells, are the one that will always produce, create, reproduce antibodies. We have like antibodies, immunoglobulin A, immunoglobulin B, immunoglobulin M, immunoglobulin E, immunoglobulin D, which is the last one. In genetics, once you get all of that, you're gonna see it tomorrow in your lectures. But it's the actual, the plasma B, the B plasma cells that will produce the antibodies that will neutralize this spike protein. When I'm talking about spike protein, let me go back again and say, you see this here, from this point here, let's say to this point here, if you see here, there is 30,000 bases. It's like 30,000 doors. That's the constitution of the SARS-CoV-2. And it has 26, remember, 26 spike protein. Okay, 26 spike protein. And out of those 26 spike protein, we have approximately 1,272 amino acids. So every 7 amino acid, we have a spike protein. Every 7 amino acid, we have an spike protein. We have this that you see here. Okay, and these are the things that actually binds to our ACE2 receptor size. Okay, that's what it binds to our receptor size. And every time the virus gets into you or into somebody else, for example, let's say here, as it's making copy of itself, this little line may be moving over here, or it may move over here. But in the process of making copies of itself, this line could actually delete itself. Yes, it could actually delete itself. and it could actually just not cause anything. So what we have seen today's day is just variants. We don't have a mutation. We have variant. Variant means that, for example, this guy that was now here somehow moved down here. And that either made it more easy to be transmitted or less easy to be transmitted. That happens to every virus that we've seen since science is looking upon into all of them. So do not believe that we have a mutation yet. Perhaps there could be a mutation, but we're gonna see, we hope we don't see that mutation. So these that you always encounter, or these that you hear about the spike protein, about the vaccine, it happens to be that there was a scientist, okay, that he figured out how specifically we could lock the spike protein into something that we call pre-effusion conformation. Pre-effusion conformation is like when the spike protein gets into a specific cell membrane, let's say here, and then it's like locking. When it lock, it's like twist around. And when like it twists around, then it goes into another stage that is called post-effusion conformation. And that post-effusion conformation is what allows the virus to go inside and infect and then cause the disease. Well, it happens to be that that the scientists, specifically in Texas, in Austin, Texas, okay, they were able to identify that in SARS-1, and since SARS-1, they already learned how to block, to just allow the spike protein to get into the pre-effusion conformation, but it locked it there so that they cannot go into the post-confirmation effusion part, in which that's what's going to make the virus to replicate. And also, once you inject these spike vaccine, because it's going to get locked into that plasma membrane, that is not flowing freely into your whole body organs, so that you understand. Okay, now many of the messenger RNA vaccine is inside of a lipid nanoparticle. Lipid nanoparticle. Let me tell you what is that. You know, when we eat butter and we put the butter in the bread, and sometimes that little butter drop in the table or in a piece of paper, and you see like a little greasy thing, that's a lipid nanoparticle. It's just that it's so small that we don't see that. Okay, so this spike protein is inside this lipid nanoparticle, along with some other factors like polyethylene glycol. And what this is done, that once you inject it in the deltoid muscle, okay, that takes about 24 hours to 48 hours to be as its peak. Okay, but guess what? We have in our body, so that all of you understand that this will degrade. This lipid nanoparticle will degrade within hours. So it's not that that stays in your body. That will degrade within hours. We have a receptor site, as you know, I said the ACE to receptor sites. When the spike protein gets inside there, it will bind, it will do the pre-effusion, right? And then it will change. But with the vaccine that we created, they took off specifically 2 amino acids that will allow for the post-binding fusion. So even though that it stay there, it will not twist and it will not bind, so that it could make duplicates of itself, allowing our immune system to phagocyte, to kill them, to break it apart. That's the good thing. So once again, yes, you are getting the messenger RNA that is going to bring the spike protein to be reproduced in your body, but it's a defective one. It cannot twist, so that it cannot multiply itself. and that gives times to our body to actually get the immune response and break it apart. All of these,
So Dante,
yes.
Sorry, just a quick question. So
Yes.
and thank you for explaining that. So we have the different variants of the virus, like we have the alpha, beta, delta, gamma, right? So when that spike protein goes into our cells, right, and then it's basically with the lipid capsule goes through the membrane, goes into the ribosomes to multiply and make more spike proteins, right?
Yes.
You're saying that
I'm sorry. Make more spike protein with a defect, not allowing
exactly
it to bind and go into the nucleus.
correct, because those two amino acids, if they were to work, then it'll go through the nucleus and it will actually change our DNA, right?
No,
if it gets into the nucleus or not?
No, it cannot change DNA because from an RNA.
Because it doesn't have the enzyme like the AIDS virus, you know.
Yes, but independent. We know that RNA could go back into DNA. We know that, but they need a specific RNA polymerase enzyme, specifically for that, so that it could go back and go into many reactions from one ladder to become two ladder. So that is unlikely that it could happen. Okay.
The reverse transcriptase that happens in the AIDS virus. Yes. Exactly. Very good. Thank you.
So, but independent of that, it's good that you bring that up too, so that everybody could look into Jason McClellan. Jason McClellan from Austin, Texas. He was the one back in 2000, before 2000, that he could identify the genome structure of the SARS, the first one, and even before influenza. And he was the one that did the codification, the decodification, the extractor. He was the one that could lack that part of the spike protein to go into a specific membrane of the cell, but do not allow to cleavage on it, because he removed what it does, the post fusion. It is amazing. That is amazing. In another word, we're going to have a huge advancement in vaccine in which we could actually identify things, allow it to come into the body, but not to create the damage, and also give time to our immune system to phagocyte, to kill it, and to defend ourselves, and to create memory of that. The good thing that happens when you get the vaccine, remember, if you get the vaccine, it will take 1 to 2 days for your body, if it's exposed to the pathogen, to the virus, to proliferate, to come out and fight and defend you. When you don't have the vaccine, it may take 4, 5, 6 days for your body to have enough antibody. But by the time you get that antibody, the inflammation process, the damage to your tissue already happened. Now you have an inflammatory process inside your body, and that is the problem. So if you
I want to ask you, before I forget, and maybe you can have on that later on, but so what happens when somebody has a defective immune response, let's say the depressed immune system, or the other opposite side of the spectrum, a hyperreactive immune system in that situation? Because we've seen that some people get vaccinated, or they get the virus and there's no symptomatology whatsoever, but sometimes some people get the virus or even get exposed to that spike protein, and they have an exaggerated response with fever, blood clots, all kinds of stuff, affecting even heart attacks with whether you have the virus or the vaccine, whichever, it doesn't matter. But it's the immune response of a specific person that maybe they have maybe a rheumatoid arthritis, or they have an immune disease, underlying immune disease, whether it's exaggerated, like I said, or it's depressed. What's your take on that?
Okay, first, there is a site that is called VAERS, okay, from the CDC, in which any people that had any side effects, any people will actually write down. Before it was only for doctors and healthcare personnel. Now it's open to everybody. If you got the vaccine and you got any symptoms, just write it down and put it there. Now, that doesn't mean that that's what's happening, so that you know. So many people go into that site and they see that somebody wrote down, I got the vaccine now, and 2 days later, I had a rash, I got this, I got that. Well, that's what they are exposed saying, but we don't really know what was the metabolic or the high risk or the existing preconditionings that this person had. So these are just like opinion based, okay? In order for have to get the facts, okay, we need to see the person, we need to see the age, we need to see the size, we need to see what pre-existing condition they had, okay? And remember, this is a country in which we have more obese people than ever. This is a country in which cardiovascular disease are skyrocketing. There is a problem also because many people think, if you go to the CDC, that maybe 0 to 4% of death are only happening because of COVID. If you go there, you will see that. The problem is that that's being wrong reported. Let me explain to you. In the death certificate, which I talk, and all of you guys that are going to go into your continuing education tomorrow, I explain about that, how they produce the information that is put into the death certificates, giving us sometimes the right information, sometimes the wrong information. Remember, we are humans. We could make mistakes. For example, let's say that you got into a car accident, right? And then we take you to the hospital. And then in the hospital, 2 days later, you died because you bled. Okay, you had an internal bleeding. So what was the cause of death? Internal bleeding. Maybe the abdominal aorta rupture and you were bleeding, right? And that caused your death, right? But that happens because you had a car accident, right or wrong? So
correct, and that comes with the coding. The medical coding was wrong. They should have also, in addition to the bleeding, they should have put a code saying, you know, that it was due to an accident, which is possible. You can
what you have in the death certificate, I could look for it too. I could show you. Is like, what was the cause of death, and that's for what he died of abdominal aorta bleeding for internal hemorrhage. Okay, but what was the cause of that? Then in the cause, you have the primary cause, you have the secondary cause, and then you have the tertiary cause. So what do we know that COVID does? Is a multi-system attacking disease. So if we already know that every 30 seconds, someone suffers and dies of a heart attack. So you died of a heart attack right now, but what was the cause? And then it happens to be that he had COVID. And COVID created, let's say, thrombosis or ischemia. Or that
it's not big thrombi, right? It's microscopic thrombi, which is very interesting.
Yes, even a stroke. What we have seen there have been some study now in which they did like 800 brain scan on healthy people before COVID. And they again did another study and they found out in these people that were healthy that they did not have the virus. And now these people were exposed to the virus and now they have memory fog. Now they have cognitive problem. Yeah. Therefore, it is a scientific base physiologically to really show that this COVID-19 really goes to any receptor site, like in the brain, causing what is causing right now. The lone hauler, the lone COVID post syndrome is there. So I don't want you to get it because there is a lot of bad things that could happen to you and to me. Thank God I don't have it. You know, but I know I'm going to get it. I know I'm going to be infected. It's not a question. I'm going to have the infection. But I doubt I'm going to have the disease, serious disease, because I'm protecting myself. So when you were talking about the immune system, in the immune system, yes, maybe you have a problem with your immunity, with your B cells, with your T cells, because that's what actually protecting you. So if you have many vitals, minerals, vitamins deficiency, your cells don't have the mechanism to either stimulate signaling, either to produce mass quantity of antibodies, and then it's not that you don't have it, it's that you don't have the mechanism to make more. And that is the reason why perhaps we see what is happening. But let me just say one more thing, that once we put that vaccine here, the messenger RNA vaccine, it takes like 48 hours to 72 hours to degrade. Listen again, I put the vaccine today. That nanoparticle goes away. It lasts a few hours. The actual messenger RNA do not exist in your body past 48 to 72 hours. It does not exist. It degrades. Your body break it down. It dissociates. So do not think that because I have the vaccine, it stays in my body for 3 months. No. What we want to get in well, that's me, you know. I'm not really get into the third shock. Okay, I'm not into that yet because I know that already my B cells have the memory. I get my 2 doses complete, very good, regardless of whoever vaccine is. Okay, I want a messenger RNA. Okay, and it will last in me between 8 months to 9 months. And after that, my antibody will go down as it's normally to go down. Because if it stays up, I don't want to perhaps develop an autoimmune disease. So
I wanted to ask you that exactly, Dante,
Yes.
because we have to, and I'm so glad that you mentioned that. The immunity, our immune system, and the natural immunity is very powerful, right? So especially with people, for example, that have gotten a vaccine, hepatitis B, for example, you have to check the titers before you inject another dose of a vaccine, for example, right? Because we are sensitive to that. And so what I wanted to ask you is, my concern is the exposure, right? We have an exposure, and we're not watching our symptomatology after we get, after we get in contact with somebody with COVID or we are exposed to the vaccine, whatever it might be. We're not watching our inflammation response. So people need to make sure that if they're getting a fever, they're getting a huge inflammatory response, that they are consulting with a physician, getting their anti-inflammatories, if they need to take a medication to anticoagulate and so forth, because people are just exposing themselves to a situation and not paying attention how the immune response is, whether it's adequate, whether they need to really seek help, and they're not really paying attention. They think, well, I get the shot, I'm done. No, that's not the case. And sometimes, like you said, you have a few days where your immune system is preparing, and during that time, wear a mask, right? Because you're not ready for the fight.
It is like that. It is sad because we have a bad educational guidance in society, and everybody think that this virus doesn't exist, that it was created. There are so many things that everybody have, and they have right to think like that. But at least follow the expert. I'm not the expert. A virologist is an expert. An infectious disease is an expert. An immunology is an expert. An epidemiology in a certain aspect is an expert. But the least of the experts are doctors. We are not an expert in that. We could read the literature, we could investigate, because we have done in medical school epidemiology, virology, things like that. But you really want to go through that one that has the PhD, that has a specialty in learning what those reports are saying, and the margins of errors or index of confidentiality or sensitivity says to us. So I encourage everybody to go into the Columbia Presbyterian University, Dr. Vincent Coviello. He is somebody that you want to go. It's called, you could go into Google and look for virology, and you will see him virology from Vincent from Columbia University. If you go there, you're going to learn like crazy, real facts from an expert that knows what he's talking about, and he could prove it. So what I want all of my people or everybody that is listening, and we are almost finishing, okay, to have some questions from anybody that is there. What I want everybody to gather is that there is scientific proof that this is bad. We have to follow scientific proof. And scientists, if something goes wrong, they will fix it and put it again, and they will publish it. That's what is science. 20 years ago, something was that. Well, now we found out that is not that, that is this. We just have to go alone. But you have to follow that. We just cannot stay back-minded. That is not good, okay? What I want to say to the phlebotomists, in phlebotomists, you need to follow your proper order of draw. You need to know what color tap tube you use. You cannot shake the tube. Remember, you want to invert to 180-degree angle on tubes that has additive and anticoagulant like light blue tap. You only want to invert between 3 to 5 times. You don't want the platelet to get activated and aggravated and make microclots, because now if I have a patient that is symptomatic and then the blood is showing with clot, okay, the D-dimer and many other blood tests is going to show an increase in coagulation. Now we think that the patient is passing through some problem, which is not. So I want you to really go through the phlebotomy PowerPoint, go little by little, write down questions. Those are guidelines. Let me say it again, guideline. Guidelines are not standard of care. Guideline is to guide us into do something better. So every hospital has their own guidelines and their own protocol, but always follow CLSI, Clinical and Laboratory Standard Institute. Almost everything that I'm talking that you're going to see is going to be based on GP 41. That's where you have all the documents of all the protocols and guidelines suggested for you to actually try to reduce that percentage of pre-analytical errors that we have in America. It's about 60 to 88%. You know what that means? That 80% of what the doctor receives as blood test result is not what the patient have, because mistake from who? From anyone that takes blood that does not follow guidelines, does not follow protocol, that do not know how to invert, that still 90% are taking blood with butterfly. And we know that butterfly is a vascular access device that will cause hemolysis. And if it causes hemolysis, now you have the wrong count on blood cells. And complete blood count is something that we always have to do, because we want to know how the white blood cells, red blood cells, platelets, you know, all the lymphocytes differential count. We need all of that. So I just want to say to everybody, please follow guidelines, follow protocols, follow the Clinical Laboratory Standard Institute. Do that, because we are in one of the best country ever, okay? And we have these resources. Use them, educate yourself. Now everybody see, and I'm happy that a phlebotomist used to be an underestimated profession. Not anymore. Now we know that we need phlebotomists. Medical assistant, they was thinking that that was somebody just answering the phone. Now we know that they put injections, that they vital signs, they do good history, they do a lot, and EKG text. So we are medical assistant, clinical medical assistant, phlebotomists, electrocardiogram, cardiac monitor technicians. They are a vital part, as well as respiratory therapists that nobody almost mentioned them. They are the number one besides nurses and doctors and everybody else. We have a whole support in medical, okay? But still, face mask, distance, and eat healthy is difficult, you know, but you have to eat healthy. Like now I want to go and eat chicharrón.
Quick question, Dante. Thanks so much for saying that. Just I know that you want to wrap it up, but in COVID patients, it was noticed that the D-dimers were very high. So if the phlebotomist is not following procedure, we could throw incorrect results. And so we need that to be very accurate. And then coming back to the inflammatory process, how many AC receptors we have in every organ in our body, the inflammation on the lungs is causing fibrosis, that's causing pericarditis. And so it's leaving sequela. And then we need to be able to identify, and have accurate laboratory information and follow through with our method. So thank you for saying that.
Anyway, it is not approved, even though that is happening. Medical assistant doing the swab for the PCR testing. In many hospitals, it's not approved, but there are many doing it because we have a lack of personnel doing this kind of specimen. And going back to the vaccination, and that's why I want to be able to again go back and say, if we are not vaccinated, our immune response will actually work, but it will take longer. And by the time our body responds, already damage is going to be happening to that membrane of the lungs, creating that fibrosis that it's going to be difficult for us to reverse that. Fibrosis, okay? And that inflammatory process is bad, okay? Anyway, I'm going to wrap it up to there. And I'm going to leave it now to Susie and to you to see if anybody has any question, so that actually we could try to respond to them.
You're muted, Susie. Unmute. Yeah, I think you got the bat when it comes to the questions. I don't see anything in the chat.
Hi, there we go. Okay, so we did have technical difficulties. A lot of our members are going to reach out to us with questions via email. I've instructed them to do so. I believe that the next live webinar we have will go way smoother. And it's been a pleasure, like always, Ms. Thompson, Dr. Joa. I learn every day something new with the both of you and with our entire board. And thank you for the opportunity and the invitation to be able to participate in this event. And that's all for me. Have a great weekend.
Well, same to you, Patricia. Next Saturday is us. You know, we always through Facebook. Most of the time we are through Facebook Live, and we have a lot of people that always follow and ask questions. So let's hope if we continue. Okay, but anyway, next Saturday we are going to be again. So anyone that is listening, post your question, English or Spanish. We could put it in English, we could put it in Spanish, okay? And then we make something happen so that everybody understand and learn a little more.
Right. Thank you so much. Thank you, Susie.
Well, okay, bye-bye. Take it easy. Everybody, I hope you do the best of what you can tomorrow. You're going to do everything in one day. Do the best you can, and we are here for you. All right. And Susie is always there for you. Okay.
I'm in the background. You can send an email and I'll respond tomorrow to the best of my ability. Just give me shoot me an email.
All right, guys. So bye-bye. Take care. Have a good one.
You too.